This lecture will cover Chapter 1, the fundamentals of the clinical laboratory. The clinical laboratory in general plays a very crucial role in the detection and diagnosis of different diseases with a patient so that it aids in the treatment of those various diseases and ailments. After a sample is collected and examined, then the laboratory staff will analyze those results, determine if they should be sent out to the physician, if they're critical values or if they're life-threatening, and then they will ultimately send those results either electronically or a paper copy. Most days now, most things are sent electronically, and that goes to the physician or the primary care provider, which could be the nurse practitioner, home health services, hospice services, occasionally veterinarian offices, wherever these results need to go. And with the medical laboratory profession, the growth of this profession is expected to grow as tests is developed, new diseases are discovered. So there is a big variety of employment opportunities for an MLT. There are a variety of individuals that work within the laboratory, so you can have administrative, pathologists, physicians, medical laboratory technicians, phlebotomists. You have all the way down from administrative all the way through clerical support, things like that. So several years ago, back in 1928, the Board of Registry was created so that medical professionals could participate in certification exams. And so once someone has taken a certification exam, this kind of gives them a little bit more credentials, so it makes them look better in the professional world, especially in the world of healthcare. And this is done by ASCP, so this is one of the main ones that we focus on. It is dependent on facility and state as to what sort of requirements they have as far as certification. Most hospital facilities do require laboratory technicians to be certified. And there are a variety of agencies out there that do certifications, but ASCP is the main one that is recognized. And so we'll take a look at some of these different areas within the lab, some of the different roles of the various employees of the lab. Now, as far as the titles that have been given to laboratory technicians, that has changed a little bit from over the past few years. You may hear it referred to as medical laboratory technician, which is an MLT, which is 2-year associate's degree, or medical laboratory technologist or medical laboratory scientist, clinical laboratory scientists. So these are like CLS, MT, MLS. So you'll hear this referred to a variety of ways, but that is usually reserved for the 4-year degrees. And then you can also specialize in the various areas of the laboratory. So someone could be an SBB, which means they specialize in blood bank. You can specialize in micro, hematology, chemistry, the variety of different areas that you can actually specialize in within the laboratory. There are also certifications for phlebotomy, and so you have phlebotomists that work in donor centers collecting units of blood, as well as the phlebotomists that we typically think of that draw specimens for analyzing. And then you also have the pathology departments, which usually your pathologist, there is a pathologist that kind of oversees or is the main medical director of the lab. And that's not to be confused with an administrative director, which is usually just overseeing the personnel matters and things like that, and just the overall running of the laboratory. Within the pathology field or within the administrative field, you can actually get a diplomat in laboratory management. That one's a little bit newer as far as the certification. And there are some states that require an additional certification or licensure. You can think of this something similar to nursing licensures, like a board of registry or a board of licensure that nurses go through. Virginia is not a state that requires additional certification or licensure. There are a few states still in the United States. A couple of them may be starting to kind of go away from it. I do know California and Florida are two states that do require something a little bit separate. And so depending on where you wish to work, you may need to obtain some sort of additional licensure to actually work in that state. Now, when you finish your MLTD degree, get your associate's degree, you are eligible to sit for the certification exam for an MLT. And most of the time people do pursue the ASCP Board of Registry certification. AMT is also another agency that is that will do certification exams. And as far as deciding which to take, it's really going to be dependent on which facility you plan to get a job at. Most facilities will accept ASCP, or they do accept ASCP, but you also have a handful now that are accepting the AMT as well. So you want to verify with whichever facility that you're applying for position for, which exam that you take. But again, this is not something that you will look into until after you have obtained your degree. ASCP has changed up the requirements a little bit, so they do now require a continuing education component. So every couple of years you would submit some sort of continuing education credits for your certification, so that you can prove that you're continuing your education, that you're continuing to stay up on the changing technologies and the things that are happening within the laboratory field. And should you continue to pursue education beyond the associate's degree, you can also go on to a bachelor's degree. There are some master's degree and doctorate degrees within the clinical laboratory field. So if you at any point wish to keep continuing your education, there are options for that, and there are additional certifications that you can obtain based on your degree or your area of interest that you wish to pursue down the road. Now, once you start actually working in the laboratory field, you will be responsible for ensuring that you are able to field any questions that healthcare providers may have. So if a physician or a nurse calls down and they're looking for some help on a particular test to order, then you've kind of got to be a little bit knowledgeable and know where to look for the particular test that they're wanting. And so in your particular role, you might have some times where you have to kind of educate them on various things, or interpreting of the test results and what things mean. And sometimes you may even have a physician that refers to a test by a term that was used 60 years ago, and so it may be a term that's not really used now. So you've kind of got to be aware of some of these things so that you're able to help these providers while you're working. And you got to keep in mind that there are lots and lots of tests out there, but only a very few of them are routinely ordered. So once you get in the field and you kind of start specializing in one area over the other, then you'll kind of start being more familiar with tests in your particular area, and as far as that expansive test menu. So going back and discussing some of the different staff within the laboratory, CLIA defines who is required for the particular laboratory. So depending on if it's a high complexity, moderate, or just a point of care type lab, they dictate what personnel should be involved. And of course at the top of that list is the director. And so the director of the lab, when we talk about a director in this aspect, we're talking about an actual, from a medical standpoint. So this is a pathologist or a PhD that oversees all of the operations of the lab. So they are ultimately the one responsible for the running of that lab if anything gets reported out incorrectly, or there's any sort of errors or any sort of sentinel event where a patient is harmed in a severe way, then ultimately this laboratory director is the one who is responsible for overseeing all of this. And then under that you have your clinical laboratory personnel. So this can include like an administrative manager, director, or supervisor, as well as any sort of direct supervisor of the area. And then of course you have your technicians, your technologists, your phlebotomists, your assistants, and things like that. And CLIA actually specifies what the education requirements are for each of these categories and who is needed for what roles, depending on, again, if it's a high complexity or moderate complexity laboratory. So CLIA sets those standards of what you need for personnel. Now the responsibilities for the actual technicians, or you as an MLT, will vary just depending on what the laboratory is, what tests are there, what are available, and different things like that. So your role will be dependent on what your particular job is, of what you're hired for. However, you are expected to kind of have a base knowledge, and so that's why coming through a program like this where we can teach you the various skills and the terminology that you'll need to be successful in this profession. So although most of the time you've got your MLTs may potentially collect samples, depending on what facility you're at. Physician's office, yes, you may actually be in charge of collecting samples and processing those. But some of your bigger facilities, like your larger hospitals, it's not often that you will have the lab techs be responsible for collecting the samples. Usually you have phlebotomists or the nurses will send those down. But do know that you will have a phlebotomy component of your courses in which you will learn how to collect those samples should you ever be in a position where you are responsible for collecting blood specimens. You'll hear of CLIA being referred to a lot within the laboratory field. And so CLIA is a division of CMS, and they are responsible for defining what the responsibility, education requirements, training, the experience of the various employees that work within a moderate or a high complexity laboratory. Now when I talk about moderate or high complexity, that has to do with the test and the knowledge that is required for those tests, and that is set by the FDA. So FDA regulates what is considered a moderate complexity or a high complexity, as well as a point of care type test. So a point of care type test might be like a pregnancy test that you could buy at a store, or what has recently come out with the COVID tests, where people can test for COVID at home. And so the CLIA regulations for testing personnel who work at a site for wave test or provider performed microscopy, in other words, the physician or the nurse practitioner does the microscopy, so maybe they're doing like a wet mount. So they're basically, the CLIA regulates that as well, but their regulations for those particular testing are not as stringent as the moderate or the high complexity. So you keep those in mind as you're going throughout the remainder of the program when you're thinking about the tests that you're doing and the knowledge base that you have to have behind it in order to make sure that you send out accurate results. So talking about those categories of tests, you have wave tests. These are considered your point of care type tests. Not necessarily point of care. Point of care is usually considered a test that is done at bedside. So there are a few tests that are considered moderate complexity that are done at bedside point of care. But point of care tests will give you a result pretty quickly. So this is usually your waved test category. So this again would be something like a pregnancy test or a COVID test or a strep test that's just done with a swab and a really quick kit test. And so for something to be categorized, they look at the things like the risk of harm to the patient, the risk of getting any sort of false results, false positives or false negatives, the particular test method that you use. Does it go through several steps? Is the person running the test able to judge it, or do they need to have something to help aid in determining and interpreting the results of that test, and the availability of test in question for home use. So this would come into your category of your pregnancy test, or your even for diabetic testing, there are ketone strips and things like that that people can buy over the counter and test at home. There are even urine strip tests out there that can help you detect if you have an infection. So these are all, the test complexity is set by FDA, and then CLIA regulates those as far as what goes into testing those and ensuring that those tests are run properly and that you have the appropriate personnel to run those tests, meaning that they have the proper education. So when we talk about those wave tests, again, these are tests that FDA has deemed that these tests can be used at home if they need to by the average person. So with these tests, there are simple methodologies. You're unlikely to cause any sort of huge errors that could be life-threatening. And so the FDA determines that these are tests that can be considered waived, meaning they have criteria that is less strict as far as performing quality control, or the records that are maintained for those particular tests. So it's not as stringent as it is for moderate and high complexity. Another category of test is called the provider performed microscopy, and of course this is when the provider, the physician or nurse practitioner, will actually do the microscopic work themselves. So they will look at it under the microscope and report out those results. And so this category is considered a moderate complexity, but the CLIA regulations behind this are a little bit different than typical moderate complexity testing. So this is one of those categories where the technical consultant or the lab director or the medical provider themselves kind of make sure that the proper training and things are in place, proper documentation for provider performed microscopies, and that's ensuring that providers have competency assessments, that they participate in proficiency samples, that they handle the specimens properly, that everything's done that should be done to make sure that these test results are sent out properly, and that that provider knows what they're looking at when they look under the microscope. So you have several departments that make up the whole laboratory department in general. So when you think about a hospital lab or a reference lab, they're usually kind of divided up into sections. So you might have some specialty sections. So usually you have your core sections, which includes your hematology department, chemistry department. That's usually in like one core area. Or you may kind of have those kind of separated off from each other, but still kind of in one common core area. And then from there you might have a microbiology department, a transfusion services or blood bank department. Usually your urinalysis and coag is incorporated into chemistry hematology. And then outside of that main core lab, then you may have some other specialty areas like molecular diagnostics. Of course, you have pathology, histology, cytology, where they do a little bit more specialized testing than what you will get involved in with your MLT studies. And so most labs, like I said, they do that main core lab, and then they also they can do some of those specialty labs. Now this would be in like a larger lab, but then when you have more smaller labs like physicians' office labs, it's usually one room where you have all of the testing, and it's usually one analyzer for hematology, maybe one small analyzer for chemistry, maybe some sort of urine analyzer, some point of care type test, or some wave type testing. So all of that will just depend on where you're at. Within your larger laboratories, usually you do have generalists who work in all areas or most all areas. So you might have someone that works in hematology and blood bank, or you might have someone that works in chemistry, hematology. Maybe they cover blood bank for a select amount of time if it's an off shift. But there's usually several generalists, but then you also have some people that will work in just your main areas, like they are specialized just to hematology or just to blood bank. And this is usually your day shift people, but not always. So again, just reiterating that the clinical laboratory does encompass a variety of different areas that work together to ultimately to send out the laboratory results, but it does kind of subspecialize. So you do kind of have the core lab where you have your main areas, but then you also kind of subspecialize off of those areas. So you may find as you're going through the program that you really have an interest for hematology. And so as you go through your clinical rotations, you find out that, yeah, I really do like hematology, but I also like micro. And so you might try to seek a position where you actually kind of work in just hematology, or maybe you work in hematology but you cover some micro as well. So those are things to kind of think about as you're going through the program of what you like, so that you can kind of start focusing on that particular area as you start looking for a position. Now, as you start going into your clinical sites, if you do have the opportunity to go in some of these really large hospitals, you might find that in that core laboratory that they have some sort of automation system where the samples are placed on it, and then it runs through the machine that will distribute it to various departments. So it's almost like an assembly line kind of thing. So it goes to the department, or the machine will actually aliquot a small bit of sample off to send to a different area, and then it'll go to that area and run on those analyzers. So it's a little bit more automated now, but those machines can get very expensive. So it's usually to your really large laboratories or your big reference labs that have this type of machinery. One of the areas of the laboratory that's starting to expand is the molecular diagnostics area. We are starting to see that a little bit more, especially with the rise of COVID. And so you will find that some laboratories are starting to branch off a little bit more with the molecular area. And then within that area, you might start seeing some genetics type testing that's going in, some different stem cell screenings, gene therapy type screenings. So this is an area that's starting to pop up a little bit more, and you're starting to see it a little bit more in these larger laboratories and like these really big reference laboratories. So that is something that you could consider down the road, getting more education on and kind of subspecializing in. So this chart here kind of gives you an idea of how the laboratory department is divided out. So you have your laboratory director, and then under your director you have your different departmental managers. And it's usually divided up with anatomical pathology, which includes your cytology, histology, and autopsy services that the pathologist will do. Some facilities still do autopsies, some don't. You have support services, which would include like your phlebotomy area, your laboratory information system, your support area, clerical services. So this is be the area that might give support to outside facilities that are trying to order it, maybe your billing, different things like that. Within your core laboratory, you usually have more managers than just one. But within that area, it can be divided out. Something similar to this, like a point of care testing area, molecular diagnostics, hematology, micro. This all is just kind of divided up based on facilities' needs. Now, the organization within the healthcare system itself is going to depend on what the facility is, what the geographic area is, the market of the area, the patient population, the size of the facility, any kind of affiliations that that facility may have as far as outside organizations. So how that organization is setup can be a little bit different. But when you look at like a hospital type setting, you usually do have an administrative type team that oversees the whole organization, and then it's kind of divided out from that level. So you might have your CEOs, your CFOs, and then up under them you'll have other different levels. So you would have people that manage the nursing, people that manage the lab, people that manage radiology, people that manage the cafeteria, the ER. So it's all kind of divided out, and usually each facility has some sort of organizational chart so that everyone knows who reports to who. But now if you're getting down to a physician's office level, depending on if they're independent, then you don't have this bigger dynamic of people. Within your physician's office levels, it's going to be pretty much just whoever's over that physician office. So it may be a doctor who owns it, unless it's a physician's office that is owned by a healthcare organization, then their structure may be set up somewhat similar to a hospital. Now those positions within an organization, those higher level positions like your CFO, your CIO, your CTO, all of that's going to depend on the particular needs and size of that organization. So some of those positions could be kind of lumped together. And depending on the particular organization, you could have some other people that kind of oversee it, different boards that kind of oversee different things. They could be referred to as a vice president, or they could just be referred to like some sort of manager type role. All that would just depend on what the facility itself wishes to call these particular roles. Now we talk about accrediting agencies. These are agencies that are going to look at the healthcare facility in general and determine are they doing what they're supposed to do to make sure that they are not hurting patients, that they're providing excellent care, that they're not having a lot of errors within the facility. So there are a lot of things that they look at. But when we talk about in a laboratory point of view, we look at we're going to talk about some of the different organizations that will regulate the laboratory in general. Now, most of these rules are going to fall back on the CLIA regulations. So the standards that are set by CMS within the CLIA documents to say what a laboratory should do. But beyond that, you also have other organizations that will look at the lab. Now, a lot of facilities will use the Joint Commission, and they've changed the name over the years for the Joint Commission. But the Joint Commission, at one point, was referred to as JACO, so you might still hear that terminology. The Joint Commission can oversee the entire hospital, but they can also oversee the lab as well. So depending on your facility, you could have be inspected by another laboratory inspection agency, or you could be inspected by the Joint Commission, or you could be inspected by multiple. Outside of CLIA, CLIA does do inspections of laboratory, but if you wish to participate in other accreditation agencies, so a lot of facilities will not do just CLIA, they will do another accreditation agency like COLA or CAP, who will come in and inspect their lab. And usually these agencies have a little bit of a higher standard, so they may require QC to be ran more often than what CLIA states. So those rules will depend on which particular organization that inspects you. Now with CAP, this is usually a group of other laboratory professionals, so your peers out in the field from other facilities that come inspect you. CLIA, COLA, they're going to be inspected by people that are actually hired by those organizations to come in and do those inspections. AABB and then some of your other institutes they accredit AABB accredits blood banks, and if you were to go through an accreditation agency like American Society of Histocompatibility and Immunogenetics or any of those other ones, they would accredit that particular department. So AABB is usually more specific to just blood banks. So your blood bank that you work at may be accredited by them. So it's just kind of like having another agency to say, hey, you're issuing a very safe product, you're doing it like you're supposed to. And so a lot of healthcare facilities will get an AABB accreditation because it does kind of give them a little bit of a leg up in the field. So in addition to organizations that will accredit and regulate the laboratory based on those CLIA regulations, you also have organizations that will make sure that you are disposing of your waste properly, that you're following safety standards, that you're protecting your employees, that you're billing correctly. So there are a lot of other agencies that will look at laboratories to decide if they're doing things like they should and that they're maintaining standard precautions and safety precautions. And so you do have other agencies out there that kind of regulate these things. So for instance, Joint Commission, when they do an inspection within a hospital, they might come through the lab to look to make sure that all personnel have personal protective equipment on, that they're wearing their gloves, that they have their protective gowns that are covering them up, preventing splashes. So they'll look at all sorts of things like this. And a lot of this is going to be implemented by the state at the state level to make sure that facilities are doing what they're supposed to do. So while we think of testing being done in a core lab, so we're a lab setting where you have all your instruments and you've got lab personnel that are just running tests all day long, you also have testing that can be done outside the lab. So this might be like a point of care test. So this could be a test that's done at bedside. So you think of something like this to be like a finger stick test for a glucose monitoring. So maybe a patient on the floor that's a diabetic and they're monitoring their glucose levels throughout the day. They may not want to stick that patient and send down a tube of blood, so they could do that off of a finger stick. Or maybe in the OR they need a rapid coag test to help them determine if the patient is bleeding excessively due to something that might be going on. So these are point of care tests that can be done at bedside, get a rapid result. So most of the time, occasionally these tests are waived, but most of the time the ones that are done in the hospital at bedside, so like in your OR or your ER, those tests will be a little bit more regulated, so they might be considered a point of care test, but they're not a waived test. But they still consider kind of moderate complexity, so they might have some additional regulations for those. You also have your reference labs, and then you have your physician's office labs. Physician's office labs are often referred to as POLs. And so your physician's office labs could be anywhere from waived to moderate to high complexity as well. Within the laboratory, we also have to think about the medical or legal issues that happen. So with this, we need to understand that all patients have informed consent. So with informed consent, that means that the patient is aware and understands and agrees to the nature of the testing that's being done and what will be done with the results once they're reported. So they should be made aware of what the risks are from like a venal puncture. They should be made aware of how those test results are going to be used. We also have to stick by strict confidentiality. So in 1996, the Health Insurance Portability and Accountability Act was put into place. And so this means any results obtained from a specimen from patients or any other information about those patients have to be kept strictly confidential. Now, if you violate a HIPAA regulation, there are huge fines involved. So you need to make sure that anything that you learn while you're at any clinical site, anything that's you see on a patient, it cannot be discussed anywhere. It cannot be posted on your Facebook page. You cannot even post that you had a patient come in through the ER with this unique case, because chances are somehow it can be traced back to the patient, because communities are small and people know people. So you do not go on social media and post about anything interesting that you find. You do not disclose any kind of patient information. So be sure that if nothing else that you get out here, that you maintain patient confidentiality at all times, or else you can find yourself paying $50,000 and find time in prison. CMS also determined in that ruling that patients should have access to the results. So with this rule, patients are now allowed to access their results. However, laboratory professionals should not try to educate patients on these results. So if a patient were to call into the laboratory asking for their particular results, you still would need to refer them to the physician, because the physician is ultimately the one responsible for treating that patient, and they're the one with the medical license that says that they're allowed to treat that patient. So all we can do is result those tests, and then from there it's up to the patient and physician to decide what to do with those results. Occasionally there are samples that must go through a chain of custody, so this could be something like drug testing or any kind of testing that's done for any sort of legal issues. And so a chain of custody, it has to be tracked every step and process that that sample goes through, whether or not that sample was locked up, who had access to it. So all of that stuff is documented for legal matters, because sometimes you do have things that go before the court system, and so when those things go before the court system, that chain of custody has to be proven where that sample went at all times. So it's always important that you always keep good notes, that you document everything in the laboratory. If it was not documented, it did not happen. And you also want to make sure that you're doing everything by procedures to make sure that you're preventing any sort of injury that could happen to you or someone else in the organization or to the patient themselves. Now, within the medical field and in the laboratory, you do have to hold a certain level of medical ethics. And so basically with these ethical standards, you make sure that you use your personal ethics based on the values and ideals and the customs that are held in high regard by an individual or group of people. And so these could be things like professional ethics or moral ethics. So these are things that we need to kind of look at when we're in the healthcare field to make sure that we're doing ethical practices. In other words, you get a sample and you drop the sample on the floor and the tube busts and the blood's wasted. You know, you don't try to take a pipette and collect that specimen off the floor and run that test, because that's just unethical. That sample's now contaminated, and you know, maybe you're worried about the repercussions of having to stick a patient again. However, would it be worse to send out results that are false? So those are the things that we have to look at in the medical profession and use our ethical judgment of what's best for the patient.